Hey, it's Patricia Murphy. It's Wednesday. This is Seattle Now. Even with ramped up efforts to distribute vaccines, we're still really just getting started. In a minute, University of Washington epidemiologist Judith Malmgren will help us understand where we're at with that and the new coronavirus variant. But first, let's get you caught up. Washington will be getting more COVID vaccines starting next week. Governor Inslee announced our weekly allotment will go up 16%. We'll also receive a special syringe that helps healthcare workers get an extra dose out of Pfizer's vaccine vials. The changes are a step in the right direction, but supplies are still very limited, as you probably know if you've tried to make a vaccine appointment. Second grade teachers in the Bellevue School District are back in the classrooms. The district and union agreed on a new reopening plan after a tense standoff over teacher safety concerns. The new plan will slowly bring kindergarten, first and second grade students back to school with new safety protocols. The district also agreed to set up vaccine clinics for educators and petition the state to move teachers up in the vaccine priority list. And Navy SEAL recruits could soon be using 28 Washington state parks for training exercises. Yep, the State Parks Commission is voting on a proposal that would extend an existing agreement with the Navy, which already uses the parks for some training. If the agreement is extended, keep your eye out for stealthy Navy SEALs training in the water and climbing the cliffs. A new and more contagious strain of coronavirus has been detected in Pierce and Snohomish County. King County Health Officer Jeff Duchin said this will lead to a, quote, Mount St. Helens-like eruption of cases. We're checking in with the University of Washington epidemiologist Judith Malmgren. Hey, Judith.
Hi, how you doing?
Getting through. Let's talk a little bit about this new contagious strain of coronavirus we're hearing about. It's been detected in Pierce and Snohomish County. How should we be thinking about this?
Well, we already had an extremely contagious virus. Coronavirus, the one we've got, is very, very contagious. I think part of the difference may be we really don't have a lot of information to go on. The sample sizes have been very small. They know it's spreading faster. There could be a couple different factors. It could be that it actually is spreading faster. But since the first COVID is so easily spread anyway, and the first COVID could be that a lot of it was asymptomatic. This may be a strain that has fewer asymptomatic cases and more symptomatic, and therefore it looks like it's spreading more. So there's just the jury's out.
Okay, that's really interesting. So people are looking sicker, sounding more sick. So it seems like it's just more in the forefront.
Well, they would be getting tested more. A lot of the problem with COVID-19, the one we have now, so many cases are asymptomatic, so people don't get tested.
I see.
So we've always had this large reservoir of disease, especially in younger persons and in children. So young adults, children, teenagers. So we've always had that reservoir, but it hasn't been quantified.
Okay.
Because there's so much of it is asymptomatic. Or it's like a mild whatever, and so people don't get tested. Now we have what appears to be more virulent, more transmissible. Could be that it is. Could be that it just is more symptomatic, so people are getting tested more.
Okay. Now, King County's Dr. Jeff Duchin has been clear that this new variant is coming to King County, but realistically, it's probably already in Seattle, right?
Oh, yeah. We are. I mean, we have no restrictions on flights in and out of the United States up until, like, yesterday or something. So, I mean, people have been able to fly here from all over with no restrictions at all. You don't have to quarantine. You don't have to wear a mask. So, I mean, it's just like, you know, it's a free-for-all here in the United States.
That sounds like it bugs you just a little bit.
Yeah, it does. It bugs me a lot. I think things are going to take a little while to change over with the new administration, and maybe a more sensible approach will come to air travel and masking and quarantining. We know what works. The same mitigation that we had with COVID-19, the regular strain, is going to work just as well with the UK and South African strain. I mean, everybody can freak out if they really want to. In my mind, we already had a reservoir of disease. This may make it more evident. If we have mitigation in place, it may not.
How should we be thinking about this over the next few months, though? Because I keep hearing two things. One, that the U.S. has passed the peak of cases, and the other is that we should prepare for a new explosion soon because of this more contagious variant.
What are you going to do? What have we not already done? I would get a new mask. I mean, if you want to talk about masking, double masking, yeah, maybe it's a good idea. But I would just like everybody to get a new mask. How about January, new mask? Don't wear that old mask. Wash it. Put on a clean one. Switch over to wearing medical grade masks where you just wear them for like a day or maybe a couple days, and then you throw them away into the garbage, and then you put on a clean one. And then you cover your whole face with it, nose and mouth, both.
I'm hearing irritation.
My voice conveys my feelings. Yes, I went to the grocery store yesterday. I had to go, and I had to go to a store I don't usually go to, but there's a lot of people in there that are wearing like these old, droopy, dirty masks. Those don't work. So once your mask is dirty, wet, been worn a lot, I mean, they're washable. But it means you have to wash it every day.
I have heard recently that double masking is a good idea, Judith. What do you think?
It may be a good idea if you are working with the public, if you are working behind a cash register, if you are, if it makes you feel more comfortable, if you have to be around people in close proximity for more than 15 minutes, may be a good idea. If you can breathe through them, it may make it even hotter on your face. I'm not sure.
People are depressed, Judith. People are over this, where we've already drawn from the deep well of reserve that we have. Now people might be just feeling just kind of crappy about everything.
Well, and their masks reflect that. Their masks are sad and tired. The masking is going to be around for a long time, so we just kind of have to just get over that and move on to the next phase of our lives. So that's not going to change. The mitigation is going to be around for quite a while. I am looking to vaccination.
Yeah. Let's talk about vaccinations. Rollout not so smooth.
No, it's kind of depressing. That's sad. I think that's going to get better. We have a system in place because everybody can get vaccinated at pharmacies. These vaccines are a little different, though, because they have to be so cold.
Right. The infrastructure around some of the vaccine delivery is critical. Are we able to vaccinate our way out of this at any point? Do you see that happening? Yes.
Oh, yes, absolutely. We will vaccinate our way out of this. And that's the hopeful thing. It's just getting between here and there. That's the problem. So we will vaccinate our way out of it. Moderna is already, and Pfizer are both working on boosters just in case that they don't have full protection from the current batch of vaccines. So everybody's been, there's been a lot of noise about this and that and the other thing. What I look at is I look and see what Pfizer is saying. I look and see what Moderna is saying, because those are the people who actually know what the vaccine can do and is needed to do. And they've got a system. So this is war. We need to put all the chips in. You're at the poker table, you get your hand. It may look good or may look bad, but you got to push all your chips in on vaccination. Right.
But right now, the messaging I'm getting around vaccinations is very confusing, right? We've opened up the eligibility. The state has expanded eligibility without having enough vaccines for everyone who is eligible. Is there
Right.
a reason for that I'm not picking up on?
Well, yes. Well, there's two ways to vaccinate. You can vaccinate to end the epidemic. You can vaccinate to end morbidity and mortality. We are going to vaccinate to end morbidity and mortality. That's why it's open to 65 and older.
Tell me the difference. I'm missing something in there.
So with most of the cases in our population are in younger people. So if you really wanted to end the epidemic, you would vaccinate the people who are most social and most carrying the disease. That would be young persons. However, they don't get sick, and they don't go in the hospital, and they don't die. They do sometimes, but not to the extent. If you look at that pie chart of deaths, it's 65 and older. That's the morbidity and mortality, sickness and death that are related to COVID-19 is very age specific.
Before I let you go, schools, What should we be doing?
Vaccinate the teachers, then open them up for short days. Get them in, get them out. Get them in, fill their brains up with stuff, and then they can go home and empty it out.
Okay. All right, one more thing, actually.
Yeah.
What are you seeing that's driving you nuts right now?
Today or yesterday?
A new day, a new issue.
Today, nothing's driving me nuts. Yesterday, it was the masks. Mm-hmm. That's bugging me the most. People are wearing them, but they're dirty, old, yucky masks, and they don't have them on their whole face. And a mask plus social distancing, that's a good thing.
University of Washington epidemiologist Judith Malmgren, good to talk to you.
So nice to talk to you, as usual.
Seattle Now is produced by Caroline Chamberlain Gomez, Clare McGrane, and Jason Pagano. Matt Jorgensen does our music. I'm Patricia Murphy. See you tomorrow.